This special show today is about people who are either enrolled in Medicare, looking to make changes, or just need their coverage reassessed. I have a special guest with me today, Maureen Morgan. She's a counselor with PMED, which is Pennsylvania Medicare Education and Information Service. She will be taking us on a journey to help those people who are looking to enroll or making changes. So please stay tuned. You can ask questions if you have any, and we will be providing you further information where you can get more guidance. So, Maureen, welcome to the show.
Thank you so much. I'm happy to be here, and PA Medi is happy that you invited us.
Well, PMED does an amazing job helping people who are looking to make changes or sign up for Medicare. Now, what exactly does this time period of open enrollment, which we are in, represent? But before you say that, I just need a little bit information about who is Maureen and what is PMED.
Okay, so I'm Maureen Morgan, and I've been a PA Medi counselor since 2015.
Wow.
PA Medi is a group of volunteers across the state of Pennsylvania. Each county, each area of our state has a group of volunteers. I volunteer for Chester County. So our volunteer group works under the wing of the Chester County Department of Aging, and under that is our PA Medi group. But just, we don't know who's listening or who's watching. Every state in the union, every county in that state has a PA Medi, not PA because that means Pennsylvania, but a Medicare counseling group that works in their Department of Aging. And what we do is exactly what you talked about, and it is that we educate and advise and help people make decisions, whether they're going to newly enroll in Medicare, whether they have Medicare and they'd like to have their coverage evaluated, whether they have problems in terms of their Medicare, their bills, they have questions. We cover a lot of different areas related to Medicare, and we do it in person. We do it on the telephone. We do it over Zoom. So there's a lot of opportunities to talk to people about it. And we also do a number of different presentations to educate. The most important thing I can say about it is that we are volunteers. We don't get paid, obviously, and we don't sell anything. All we do is train, educate, advise, answer questions. And that means that we give a neutral position. We don't recommend one thing over another. We don't represent one thing over another. We give information and advice, and then we hope that you get enough information to make a good, educated decision.
And information that you provide is unbiased. Now, when people are reaching their 65th birthday, they get bombarded with solicitations by mail, by email, by phone calls. Hey, we offer you Medicare Advantage plan and so many other things that appear too good to be true. And what I had understood after talking to PMED was those Medicare Advantage plans are only advantageous to the healthcare insurance company, not to the members most of the time.
I guess I would be a little bit more neutral than that. But the one thing I would say is that those people who get bombarded, as you described, are not just people who are 65. There are people who can join Medicare and who are on Medicare who are permanently disabled below the age of 65. So they can get the same bombarded that the other people get. And the other thing I would say is the bombardment, especially on television, has been toned down quite a bit this year because the federal agency that controls Medicare, CMS, has really cracked down on those advertisements. Right. And they've gone from being very confusing, which is exactly what you described, to being also in a more neutral position. They're more like reminders, like go get your coverage evaluated, see if there's anything out there that's better for you. And they've stopped all of that crazy stuff about, and you're eligible for this, and you might be eligible for that. We had so many people come to us confused. You said that word, and that's really the right word to use. With regard to Medicare Advantage plans, which is your question, they have some advantages and they have disadvantages. I think it depends on the person. It depends on their pocketbook. It depends on how much freedom they want to go to any doctor or any hospital. And it depends on how sick they are or how healthy they are. But the most important thing to think about is if you're going to go in that direction, you need to make the right choice, because there are a lot of moving parts in all Medicare Advantage plans, and they have to be carefully matched to what your needs are. We see a lot of people who say, my next door neighbor has Plan X and they love it and I'm going for it too. That's a big mistake, because each of those plans need to be tailored to what your needs are, which could be very different from your neighbor, your brother-in-law, whatever. So it is true that people often pick a Medicare Advantage plan and might be unhappy with it. They might be unhappy with it because they didn't know the fine details before they signed up. They might be unhappy with it, and this is where we see most people get unhappy with it. They were super happy when they signed up for a very low monthly premium or even zero premium. But the Medicare Advantage plan is structured such that you pretty much pay as you go. So if you go to see a lot of specialists, for instance, you might be paying $35, $45 out of your pocket each time you go. And all of a sudden, your perception of what the cost of that plan is a lot more than what it was before. But they do have some benefits. They have some dental coverage. They have some hearing coverage. They have some vision coverage that the other side of the road that you might take does not have. Often they do not offer you the freedom that the other road will give you. You have to stay within network for most of that. So it really does depend on matching your pocketbook, your preferences, your doctors, your drugs, very important that your drugs match with that plan. They're not at all terrible, and we don't advise people away or towards. We give them the information and say, this is the level of detail you need to know in order to select the right Advantage plan for you.
Right. And then, as you mentioned, they need to be in the network. So if somebody lives in Chester County and they are going away on a vacation, whether in-state or outside, and where they are, there are not facilities that are in network, then they may not have the full coverage.
Correct. And that's why you have to be careful to match what your needs are. If you travel 6 months out of the year, something like that, there are a few Medicare Advantage plans that have very large networks, including even places in Florida. Many Medicare Advantage plans have very small networks. So you're right. If you go over the county line, never mind the state line, you may have either no coverage or little coverage. So again, it's sort of a personal, if you know you're going to travel, then you really need to look at which plan you're going to select to make sure that you have, what you need when you get there.
Right.
And at this point in time, it's almost, there are probably 50% of the people who are on Medicare who actually have a Medicare Advantage plan. So, some people are very happy with it and some people are not. And you mentioned open enrollment before, which I'm sure we'll talk a little bit about. But the good thing is that you can change your Medicare Advantage plan every year if you want to. And you should evaluate it every year. We want you to, and we'll help you through that. But the reality of it is that things change, they change, you change, and you get the opportunity to make a change each year at the end of the year at open enrollment. So in that way, you're not stuck with something forever.
Absolutely. Now, can you briefly describe who are the category of people who are eligible for Medicare? You mentioned over 65,
Okay.
and then, yeah.
All right, so there are basically three categories of people, those that everybody probably associates with Medicare, and that is anybody who is over the age of 65. You're eligible to join Medicare. If you have been declared permanently disabled by Social Security, meaning you get Social Security disability money. They've declared you permanently disabled. If you are in that category for 24 months, you are automatically eligible for Medicare, and it doesn't matter what age you are. But you have to wait the 24 months, even if you're 27 or 47 or whatever, however old you are. Then there's a third category of people who have life-limiting diseases. Lou Gehrig's disease, for instance, end-stage renal disease. Those people, because their life expectancy is so short, no matter how old they are, also are immediately eligible to join Medicare. And all of those people have to make the same choices that we just talked about. Just because you're over 65 or you're disabled but under 65, you still have this plethora of decisions that you need to make in order to make sure that it fits you well.
Right. Now, how can people reach out to you?
Okay, well, actually, you've done us a favor there, because scrolling down on the bottom of the screen, next to my name, you can see that our website address is listed and also our phone number is listed. So I'll tell you a little bit about the phone number first. That phone number that's listed there is active 5 days a week, Monday through Friday from 9 to 5. And as volunteers, we all get either volunteer or assigned days and times where we literally man that phone. So if you call, you'll get an answering machine and will tell you that you've reached us, and we will get back to you sometime, hopefully during that day. Usually it is to answer your questions. Now, sometimes as a result of that call, you really need to set up a one-on-one appointment because we need to delve deeper into your issues. Maybe we need to see your records. There's a lot of things that we would need. Sometimes people just ask a one-off question and good conversation and we're done. But that phone number, as I said, Monday through Friday, 9 to 5, we'll answer it and get back to you. The website that's published, that is our landing page. That's the PA MEDI page, but it is part of the bigger Chester County Department of Aging website. On that page, there's a lot of information. This phone number is there, but there's also information about what we do. There's information about where our counseling centers are. There's information about the presentations that we do. There's a schedule, a calendar that lets you know when and where those presentations are and how you enroll. So that's a very good website to keep handy because it's got everything that you need to at least contact us and get the ball rolling.
And counselors are available Monday through Friday, all 52 weeks of the year.
Yeah, that phone number that is there, absolutely, except for holidays.
Yeah.
We answer that phone number all year. That's correct. Mm-hmm.
Right. Now, when should people call you? Now, I know we talked about different categories of people becoming eligible at different times.
Mm-hmm.
And you also mentioned about the open enrollment period. So briefly please summarize what your open enrollment period is for, and at other times people would call before, if they are approaching their 65th birthday, how long before they can call and when should they sign up?
Okay, so we'll do the sign up question first and then we'll do open enrollment later.
Sure.
So if you are eligible for Medicare because you're approaching 65, Medicare allows you to start the enrollment process 3 months before your 65th birthday. So enrolling in Medicare Part A and B is, when you do that, good time to call us, or you can call us when you think you're approaching it and we'll talk to you about everything. But your question was, how early can you start the process? If you're 65, you can start that process 3 months before your 65th birthday. If you are on disability, meaning Social Security has deemed you disabled, and the rule is that you need to be disabled for 24 months, Social Security actually keeps track of that. They know how many months have lapsed. And so as that approaches, you actually get a message from Social Security and they say, you are about to become eligible for Medicare. We are enrolling you, and you get the information that way. If you're in the third category where you have been diagnosed with Lou Gehrig's disease or you've been diagnosed with end-stage renal disease, you can apply immediately because it's not age related. and it's not long-term disability related. So 3 months before your 65th birthday, if you're healthy and you want to enroll, you will get automatic flag from Social Security as you come upon the 24th month for being disabled. But if you have Lou Gehrig's or end-stage renal, you can enroll at any time.
Now,
Did you want me to go on to the enrollment?
I have one more question that I want to ask you. Now, those people who are approaching their 65th birthday, however, if they are working and covered by health insurance at their place of employment, they could wait for some coverage through
The answer
Medicare?
to your question is yes, with an exception. If your employer has less than 20 people, then that's a conversation that you need to have with your employer, because the Medicare rules say that Medicare is secondary and they will be primary. So if you have an employer that has less than 20 people, and when I say less than 20, I don't mean 20 in the office that you're sitting in. I mean less than 20 corporate wide. Then you need to approach your employer and see what's, what they're doing. But the Medicare rules kind of flip, because Medicare becomes secondary then. If you are over 65 and you want to continue to work and you're at an employer that's over 100, you really don't have to do anything, because Medicare looks at employer coverage as what they call credible, which means it's as good as or equal to anything that Medicare can cover you. If you have that kind of coverage, Medicare says, we see you, we see that you're 65, we know that you're eligible, but you already have this coverage. And until you retire, get fired, laid off, whatever happens to you, and until you lose that coverage, you're good the way you are. Now, there are many people who will decide to, at that moment, just enroll in Medicare A. They're eligible to do it. It's free. Put your foot in the water, sign up for Medicare. And then when they lose their coverage through retirement or whatever, they'll go ahead and start the rest of the process to sign up for the rest of the things that they need for Medicare. I will say, however, that we have some people who come to us who are in that category. They're over 65. They have employer insurance. They're all covered. Medicare is good with that. But they would like to compare the coverage and the cost that they pay for their insurance at their employer with what they would get if they went out and just signed up for Medicare and signed up for these other programs. Sometimes it's worth their time and money because it's less. They might get better coverage for less money if they go on Medicare. Often it's not. People just we do the comparison. They take a look at it. They go, oh yeah, this is pretty good. I think I'll just stay until it's time for me to go. So again, it's not a 100% black and white, straightforward situation. And that's why we're here, because we talk to people about what their issue is, what the fine points of their situation is, how they're going to make their decision, and then we kind of just try to help them as much as we can.
And now those people who are approaching 65 and still working, do they get penalized if they sign up for any of the Medicare programs late, like
No,
drug prescription or?
No. The answer to that is no. And that goes back to something that I said before about credible coverage. As long as Medicare perceives that you have credible coverage, hospital coverage, outpatient medical coverage, drug coverage, they look at it and they go, yep, that's as good as or even better than Medicare can offer you. There's absolutely no penalty. You can work until you're 85 if you want to and maintain your employer coverage. And once you lose your job by whatever means that happens, you go on Medicare as long as you sign up. The other thing people, I think, have to be conscious of is you don't want to have a gap in your coverage. You don't want to lose your employer coverage and then wait several months before you make a decision, because you can go to the hospital or get hit by a car or have some, health issues, and you'll have no coverage at all. So you want a smooth transition from employer coverage to your Medicare coverage. But as long as you have coverage that, as I said, Medicare looks at as credible, absolutely no penalty whatsoever once you start the Medicare process.
And how is Medicare processing the applications? if they sign up, maybe a few weeks before their before when they should be eligible for coverage. Like if my date of birth is in the middle of the month or toward the end of the month, but the Medicare coverage begins on the first of the month in which you turn 65. Isn't how that works?
Yes, that's correct. But I thought you were asking me something that I might not be able to answer. And that was from the time that you sign up to the time you get the card in the mail, what is their lead time? That's a little bit of a hard question to answer. You know, that kind of changes. The mail kind of sometimes influences how long things go. But the thing that people need to remember is it's not just the time between when you sign up for Medicare A and B and get your card. You also want to sign up for some of the other things that maybe we're going to talk about, but you talked about one before, and that is if you're going to sign up for a Medicare Advantage plan, you have to get that ball rolling. So you don't want to just sign up for A and B and then say, oh, I don't need to do any more. You need to think about the coverage that you need in addition to that. You need to think about your drug coverage so that you get the whole package sort of at the same time.
Right. So people need either Medicare Advantage plan or Medigap plan.
Mm-hmm.
And that is where you help them make the right choice.
Mm-hmm. Yeah, and again, if you have a Medigap, which we haven't talked about yet, but you will need a drug plan in addition to a Medigap. A Medicare Advantage plan covers all. It's one big ball of wax: hospital, medical, drugs, some dental, some hearing. It's like all one card. If you go the Medigap or the Medicare Supplement route, that covers hospital and medical outpatient. You need a drug plan. So you have a lot of choices to make, financial choices, all kinds of choices. But you want all of that to be in place fairly soon because you want A and B to cover what it covers. You want those things to cover the rest of what coverage you need, and you don't want to have any, you don't want to have any gaps.
Absolutely, absolutely. Now you mentioned about but before we go further, you were going to talk about the open enrollment.
Yes.
Yeah, let's do that.
We said we were going to talk about that. So
Yes.
we talked about the fact that people who need to originally enroll in Medicare, those three groups, and when they can enroll. So now let's move forward. All of them are enrolled. They made their choices. They did what they wanted to do, whether they were disabled or whether they have a Medigap or whatever. So then the question is, okay, what chances do I have to make some changes or make adjustments? What if I don't like this coverage anymore, or I have new drugs and I need coverage that wasn't covered by my old plan? So that takes us to what you're talking about, which is the Medicare open enrollment period. Everybody's heard that one on television, I'm sure. Every year it's the same. It starts on October 15th and it ends on December 7th, meaning midnight, December 7th. And during that period of time, if you have a Medicare Advantage plan or a drug plan, you are absolutely free with no penalty and no questions asked, make a change for the coming year. And October 15th is sort of a magic date because that's when all of the new plans for next year are actually available. We don't know them until then. So we couldn't give you any good advice about what's coming up for, let's say, 2024 until that date comes. So we are currently in the height of open enrollment now. And that means that, and we welcome the crowds because our advice is get that Medicare Advantage plan or get that drug plan evaluated every year because they make changes in their premiums, their co-pays, their drug lists, their network, all of that stuff. And they will send you information that says, hey, we've made some changes. But a lot of times people don't read that. Sometimes they do, many times they don't. But anyway, you can make an appointment with a PA MEDI Counselor and we will take you through the new plans that are available for the year that's coming. And once again, you have to make that match. Your doctors, your drugs, all of the things that you are important to you, including what your out-of-pocket cost is going to be before you make a new choice. But we always encourage people to do it because very often we can see that people will be able to save money by making a change. And they will either have the same coverage or better coverage than they had before. Sometimes that's not the case. Sometimes you look and there's nothing better than what you have. Sometimes they're forced into a change. Like this year, there's a drug plan. They're basically going out of business. So, we've had a ton of phone calls about, hey, it's going out of business. They sent me the notice. I have to definitely make a change. They were happy with it, but it's not even going to exist next year. So there's a lot of reasons to make a change. You have a lot of freedom to do so during that time period. And in no way will you be financially penalized by making a change. And they will not ask you any medical questions to make a change if you have a Medicare Advantage plan or a drug plan. And that's where open enrollment is. That's where the action is during open enrollment.
Now, while we know that Medicare Advantage plans offered by different insurers, they are different than they can be different than each other.
Very different. In
Very
fact, even if you pick an individual company, I won't pick on anybody. Aetna, Blue Cross, IBX, Humana, Cigna, you name them. Where I'm not pointing to any one company. Within that company, they may have 5 or 6 or 7 different plans.
Oh, is that right?
Oh, yes. So people come to us and we say, okay, what do you have now? And they say, and they name it. They say Aetna, Cigna, Humana. And I was like, okay, which one? Let's see your card. Because in order for us to know what they even have now, I mean, we can actually find them on the Medicare website. That's a different conversation. But people often say, oh, I have Aetna, and think that that's the end of the discussion.
Mm-hmm.
But what you said is absolutely true. Not only are there within different companies, different plans, each of the companies have different plans from each other. And of course, there are people who are still on employer plans, which you were talking about before, who also say that. They say, oh, I'm my employer, gives me the plan and they subsidize me or whatever. And I have Aetna. But the reality of that Aetna plan is different because the company has negotiated like a deal with Aetna.
Right.
Whereas the other things that we're talking about sort of on the open market are plans that you can see on Medicare.gov, and you can see all of the details from them. So when people come in to say, I'd like to do the evaluation between my employer insurance and whatever else is out there, we say, please bring your employer insurance information with you. And I don't mean just the card. Bring the explanation of benefits, the booklets, whatever, because we have no idea of what their company has offered them. It's some version of something. But yes, there's a lot of variation, and that's the key to picking.
Now, while Medicare Advantage plans are all different, would you say that the Medicare Supplement or the Medigap plans are all created equal? Or I mean, they may be priced differently, but do they provide the same value?
So the answer to that question is yes, as long as you understand how they're structured. Medicare supplements have, they don't mean much, but they have confusing letters attached to them. So you can get a plan A or a plan G or a plan C or a plan N. Now, within that letter, the letter is the key to what they cover. The letter tells you all of the features and all of the benefits that you get. But what you just said is correct. And that is, once you say, I would like these features, and that means it's a G, no matter which insurance company you go to, and we can name many of them, a G will be a G, will be a G, will be a G. Now, there is something which is called a high deductible G, but apart from that, so basically, when you pick on the features that you want, and then we can help you to show you which companies offer a G to you, because it's based on your zip code, your gender, your smoking history. And so when we pick it, we need to punch that information in because the pricing is done variably. So you can get a G for $150 a month, or you can get a G for $320 a month. That's just an example.
Right.
So it always pays to shop for a gap, a supplement, or a Medigap, as you called it. Those two words are the same. Medigap and supplement mean exactly the same thing. Because once you make the decision about which letter plan you want, it's the same coverage no matter which insurance company you choose. So you can choose on price at that point.
And different insurance company prices are different, even though they offer the same menu.
Yes, exactly. I just gave you the one
Yeah.
of many examples. You can get a G for $150 or
Right.
$320. Why would you choose $320? Some people have preferences.
Right. And also, there are private health brokers. And if they are dealing with a certain company, when you go to them, you will only get what they are offering. While when people call you to get assistance, you would provide them full, unbiased information from which they can choose from and save money.
Yes. So, and you mentioned brokers. Let's talk about that. So, yes, you can come and have a MEDI counselor give you the information that I just gave you. And we have a list of, you can see the plans that are available, all of them, and all of the pricing. And you can say, oh, okay, I think I want to buy a plan N and I can see the prices. So I'm going to pick the one that's the least expensive and it's insurance company X. In order to obtain that plan, you either need to go to a broker or you need to approach the insurance company directly. Some of them sell directly and some of them will send you to a broker. One way or another, somebody who's licensed to sell insurance needs to sell you that plan. So yes, if you go into a broker cold, and this is not a critique of brokers at all, brokers have relationships with X number of companies. They can't have 500 insurance companies. They have X. And so they will give you a sort of universe of what we just talked about. They see the same database that we talked about, and they can say, within my universe of 17 insurance companies, this is what I have. But there's way more than 17. I can give you an example of what happened to me, actually. When I bought my Medigap, I did exactly what I just described to you. I knew what I wanted. I went to the broker and I said, this is what I want to buy. And he said, I don't represent them right now, but if you give me a week or two, I'll do my paperwork, do whatever he has to do to represent them, which he did. And I bought it through him. I had to buy it through somebody, and I bought it through him. So if you know what you're looking for, you're in a better position than if you don't.
And if you have time, if you have time, say for example, in certain cases, when you are either in open enrollment or if you are approaching 65, then you have to make that selection within that time frame so that you're.
No, that's not true. No, that's not true for supplements. Supplements, Medicare supplements / Medigap policies are not attached to open enrollment in any way, shape, or form.
Right,
You
right.
can choose any date of the year that you want to try and do this shopping. If you're approaching 65 and you know it, right? You want to get your ducks in a row. And so you can do this research ahead of time.
Absolutely.
And then make the choice so that it falls into place when you need it. But if you are already on Medicare, for instance, and you've already made your choice and you want to shop because you think, oh, I've been on this for 5 years and the premiums are getting kind of high and I think I'd like to find something better. Absolutely, at any day of the week, any month of the year, you can start that process of evaluating and shopping. What will happen to you, though, at that point in time, no matter which plan you choose or which broker you go to or what advice we give you, the insurance company is going to do what's called medical underwriting. They are going to look at your medical history for, let's say, 5 years back. They may call you to speak about it. They may make you fill out forms. They approach your doctor. They look through your medical records. They make a decision at that point as to whether they want to insure you. And it's based on your health status and their risk sort of averseness. If they want to take a risk on you, if your health isn't good, they may offer you a policy, but at a high price. Or they may just outright say, no, we're not insuring you. And we see people who shop successfully quite often. But we've also seen people who have been denied by 5 or 6 different companies because their health is just not good enough for that company to insure them. But to your question, any time of the year you want to try to shop, you can do that for Medicare Supplement or Medicaid.
Right. However, for that insurance to become effective, start early rather than late.
Oh, of course, that's always good advice because you never know what glitches are going to happen along the way. It could be paperwork glitches or the glitch in the mail or whatever. So yeah, definitely, that's wonderful advice.
Right, right. Yeah, Maureen, I think we covered a lot of great information. I learned something, and I'm sure our viewers would find this information very useful. As you mentioned, they can either call the number to speak to a counselor, maybe
Mm-hmm.
set up an appointment if necessary,
Mm-hmm.
or you have many senior centers in Chester County that offer in-person counseling.
Okay, so the way we work is because we're volunteers, any place that offers us free space or free anything is where we go to do it. So on the website that you're scrolling there, the counseling centers are listed and the senior centers are part of that group. They're not the only place, but they are. But what happens is the group that I volunteer in are then either volunteer or assigned to go to that location on those days and those times. So the
Right.
senior centers are graceful enough to literally offer us office space. During open enrollment, the libraries offer us
Mhm.
space. Some other areas, sometimes state representatives will offer. Anybody who will offer a space is where we will go, and that's where in person happens. But you can also get a one-on-one, which would be not in person as in face to face across the desk, over the phone or on Zoom, but you have to make an appointment to have that happen. You don't
Right.
necessarily have to go to that space, but you do have to have an appointment. Whereas when you call that number on a daily basis, we may be able to answer your question right there and then, no appointment necessary, no travel to whatever. It
Right.
really depends on the nature of your question. I will also tell you often people will call, but they're sort of really not prepared to have the discussion because we need to step through paperwork that you have and maybe
Mhm.
information that you got from Medicare, and they don't have it on hand right there. So we tell them, okay, the best thing to do is bring all that stuff with you and be ready for an appointment when you have questions. But very often we answer questions right on the phone, and that's it. People, they have their answer and away they go. So whatever way works for people is, we're open to that.
Maureen, is there anything else you want to say that we may have either not covered, or if you want to just remind people to?
Mm-hmm. Yeah, there's one thing that you'll see on our website, and that is that we offer educational sessions. We do something which is called a Medicare 101 for people who are just new to Medicare. Doesn't matter how old you are, as long as you're new to Medicare, because it steps you through the language and the differences in the plans that we talked about. It's not personal counseling; it's a group, group experience. But we do that for people who are new. Then we do something which is called Medicare 102, which, surprise, is aimed at people who are on Medicare. And we talk about some of the things that we talked about today. And during this period of time only, we do something which is called Fine Tune Your Medicare. Definitely for people who are currently on Medicare in the verge of the open enrollment period. And we talk about some new things that are coming up for 2024. And again, we used to do them exclusively in person before COVID, then we switched exclusively to Zoom. The Zooms are actually done through the gracefulness of the Chester County Library system. So they loaned us the Downingtown Library, Chester County Library, all Easttown Library, all the libraries loan us their Zoom platform, and we present over that. We do have some in-person ones now also. So it depends on, what's convenient for you. 101s are usually done in the evening because we know people are still working. 102s and the open enrollment ones are a lot of times done during the day because we know there are people on Medicare who maybe, not always, but maybe not working. So we try to tailor the times to the needs of the audience.
Great. So people can definitely reach out and get more information on your website, which is coming up on the screen,
Mm-hmm.
and also call the phone number Monday through Friday and speak to a counselor or set up an appointment if required.
And it might be me, who knows?
Right, right, right. Maureen, I again thank you very much for joining me today to inform and educate. We do this spotlight show every Saturday at 10 o'clock live, so people have a chance to ask questions and get answers. Next Saturday, we will have another guest to talk about issues that are important to the community. And we sometimes bring in local small businesses to spotlight their products and services, and community organizations like PMED and such other voluntary charitable organizations. So please join us next Saturday at 10 o'clock and keep watching. Thank you very much.
Thank you.
Maureen, go ahead and enjoy your rest of the day. And thank you again for joining me.
Oh, thanks for inviting. We always like to be able to get the word out to the community. Thank you.
Right. Thank you. Okay, bye-bye now.
Bye.
Oh, Maureen, just
Yes.
stay on